Welcome back to Rural Health News, the segment of Rural Health Today, where we'll fill you in on the latest in rural health headlines. We'll cover one main headline in today's episode, President Trump's new great healthcare plan, and what it may mean for rural health. The biggest headline in American healthcare is the new so-called Great Healthcare Plan, which sets out to hold insurance companies accountable and bring down costs for beneficiaries. According to President Trump, the Affordable Care Act and Obamacare are unaffordable. He calls them unaffordable scams designed to make the corporations rich. The president's recent video briefing highlighted unprecedented transparency for insurance payers, calling out Medicare and Medicaid specifically as sources of concern. So far, this is what we know about the Great Healthcare Plan. The plan will endeavor to lower prices for both prescription and over-the-counter drug prices, lower insurance premiums by eliminating subsidy payments and funding a cost-sharing reduction program, while holding big insurance companies accountable with improved transparency around claim payments and denial rates, while maximizing the price transparency of any insurers accepting Medicaid or Medicare. An analysis by a KFF health news expert poses the following critical questions. Why is the plan contradicting the work of the One Big Beautiful Bill and what was done to push subsidies back on the backs of the American people? The president's claim the plan will send the money directly to the American people, but how? And what does this mean for the marketplace? Will the plans benefit the population with pre-existing conditions who currently rely on the ACA markets? And how will eligibility for this very vague financial aid be determined? Ultimately, we need more information before we can even start to evaluate how this will impact patients and hospitals, but rural hospitals are not included in the plan's language, nor in the president's video presentation of the plan. Following the original announcement, the White House hosted a rural health roundtable to focus on affordability, primarily discussing the impact they expect the Rural Health Transformation Program will have. Unfortunately, there still doesn't seem to be an understanding that replacing volume-based reimbursement to hospitals with innovative, tech-driven grant mechanisms will not make rural health sustainable. A fact sheet from the White House even explicitly stated that funding reimbursements for healthcare services do not promote long-term sustainability for rural health facilities. This conclusion is based on a series of details that leaves out relevant and necessary factors to understanding healthcare reimbursement. CMS Director Oz lauded states for their ideas to use this funding. But as we've discussed on this podcast in previous episodes, state applications have not been representative of the true needs of rural hospitals. We share the concern of many rural hospitals that the gap in funding we'll anticipate seeing over the next 5 to 10 years will have long-term devastating damage on the entire infrastructure of our national rural health system, leaving millions of Americans without the access that they need to the care that they deserve. From the one-page statement on this plan published by the White House, it is impossible to know how any of these goals will even be accomplished, and it's already facing great skepticism from both sides of Congress. The Democratic Party has responded to the plan with considerable resistance, and many Senate Republicans have expressed confusion and uncertainty since the plan was originally announced. Separate from the president's plan is a bipartisan healthcare deal revealed just a few days after the Great Healthcare Plan's big announcement. The 771-page deal doesn't renew ACA subsidies, but it does extend telehealth flexibilities through 2027 and the acute care at home waiver program for 5 years. Medicaid disproportionate share cuts would be delayed to 2028 to protect safety net hospitals, and Medicare rural hospital payments would be extended an extra year for Medicare, dependent on the hospitals and the low-volume hospital adjustments. If this plan is going to make it through, Congress will need to act soon to get ahead of a government shutdown and to curb the trajectory of the president's great healthcare plan. Thank you to our sources for this episode, and please check our links in the show notes to learn more about these issues. Special thanks to KFF Healthcare News, the White House, Politico, Healthcare IT News, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.